Good afternoon. Welcome everyone to our first QRTP Trauma Series training presentation. My name is Stevie Romano. I am the Bureau Chief of Foster Care Licensing with the Ohio Department of Job and Family Services. We are so excited to have you join us today for what we really believe is going to be the first of many valuable and resourceful information for you as you are continuing to build your QRTP compliant agency and as well as maintaining those requirements. So we have put a lot of time and energy into reaching out to you directly through a QRTP training needs survey. You answered well. Lots and lots of great feedback, and from that we were able to start developing a series that is very specific to the needs that you requested. So with that, I just want to welcome you. We're so excited for this first training today. Hopefully you'll join us every month during this series. And with that, I'm just going to say enjoy, get everything out of this that you can. And I am going to turn the presentation over to Kim Kale, who is our Trauma-Informed Care Project Manager, who has single-handedly been the backbone behind standing up this training series. So I'm going to turn it over to Kim. Thank you. Have a wonderful, wonderful time today.
Great. Thank you. Thank you, Stevie. I as well would like to welcome everybody. One of the unique parts about setting up this training program was that we have people who are in similar jobs like you. So they're people who have been doing trauma-informed care work for a while that were identified through the training survey or that have been brought to our attention. So I think that's going to be a unique part of this. So our first presenter is Tyler Grimmett. Tyler is with NECO. He is the Director of Campus Living. Tyler has been with NECO for quite a while and has a number of varying jobs within that organization, the primary of being the Director of Campus Living. So in order to maximize the time that we have with Tyler, it's my great pleasure to introduce Tyler Grimmett, Director of Campus Living with the NECO Center.
Thank you again, Kim. Everybody, I'm Tyler Grimmett, and as Kim said, I'm the Director of Campus Living for the NECO Center. We're located in Lawrence County, Ohio, by a small town called Ironton, Ohio, the very southern tip. I'm excited about this opportunity today, and we're going to get into it. Before we get too far, I'd like to share, you'll hear a variety of verbiage. This kind of a mixture between NECO's corporate culture, the HOPS principles of reeducation, trauma-informed care, and the CALMER approach, which was developed by Aldrich Pele out of Westerville, Ohio. So we'll get into a little bit of who NECO is, or who the NECO Center is, and then we'll get into the 6 principles of care and some principles of reeducation. So our residential program is located near what's called Lake Vesuvius, which is out back of Ironton, Ohio. We are a licensed children's residential center. We're licensed by ODJFS, and we serve males ages 9 to 21. We are QRTP certified, and our program's a bit different from a lot of others, and that's because of the types of individuals that we serve. All of our guys, they have some sort of intellectual disability, and it varies. We work with a lot of young men who have autism, and their needs span that spectrum. All of our fellows do have some sort of trauma history that we do our best to meet. And then along with what else they have going on, there's also a behavioral and or mental health emotional diagnosis. Our team within our residential program consists of direct care staff who are known as skill builders. We've also got a team of cottage captains, and those are cottage-specific supervisors. So we have 4 cottages on campus, and again, each one has 1 to 2 cottage captains. And then we've got our shift coordinators who supervise all of campus 24/7. Our school is also on site and we contract with Westwood Prep Academy. They're an Ohio public charter school. And then our nursing team, it consists of RNs, LPNs, and certified medication administrators. We also have a supported living program that's not licensed by ODJFS, but instead by the Ohio Department of Developmental Disabilities. And within that program, we serve individuals in their home, both males and females, and we provide homemaker personal care and waiver services, adult day support, vocational rehabilitation, and nursing services as well. And finally, our behavioral health program is licensed by OMOS as a community mental health provider, and they provide things such as day treatment, case management, and therapy. And that team is made up of social workers, counselors, all of who are licensed, case managers, and qualified mental health specialists. Now, no matter the department or the office within NECO, though, we all try to live by the Hobbs 12 principles of reeducation. Now, we're not going to get into all 12 Hobbs principles today, but to give you a quick summary of what those are, Dr. Hobbs, he started things really early before a lot of other people did, as far as how we look at youth and individuals who may have trauma histories or some mental health needs. And the focus was on re-education and included a lot of the person's environment and how the environment that we're in can shape who we are. And the goal is to help people feel comfortable in their own skin and to learn ways of healthier living. So today, as we go through our 6 principles of trauma-informed care, we're going to tie in 5 of the Hobbs principles to those, and those that we'll be talking about. The first is life is to be lived now, not in the past, and lived in the future only as a present challenge. Trust is, and number 2 is trust is essential. It's the foundation on which all other principles rest, the glue that holds teaching and learning together, the beginning point for re-education. Third would be feelings should be nurtured. They should also be shared spontaneously, controlled when necessary, expressed when too long repressed, and explored with trusted others. Number 4, a child should know some joy in each day. So again, children should know some joy in each day and look forward to some joyous event for the morrow. And lastly, ceremony and ritual give order, stability, and confidence to troubled adolescents whose lives are often in considerable disarray. So again, as we go through the 6 principles of care, we'll kind of slide some more Hobbs discussion into these. But before we get to that, let's talk about our QRTP approved trauma models of the NECO Center. We use 2. The first is trauma responsive care and the CALMER approach, and we've been doing that at the NECO Center since 2018. Again, it was developed by Kevin Aldridge and Laura Pele of Aldridge Pele. And what we do with that is we take trauma-informed care and we focus on not only being informed about what trauma is, but how do we respond to trauma? How do we process our own trauma as well, to where we are better stewards and caregivers of those we serve, whether it's, again, and that it doesn't matter what program that's in, but also it's geared towards us as stewards, to help us feel safe, connected, and in control when working with one another, but also when working and taking care of the youth and the individuals that we're serving. Because if we feel safe, connected, and in control, it's going to be easier for those we're caring for to feel safe, connected, and in control. We also utilize trauma-focused cognitive behavioral therapy. Brief summary of it identifies someone's trauma history and their exposure. It focuses on problem solving. Again, it identifies our immediate trauma reaction needs. That way we can best help someone to regulate and keep as Sarah Buffy would say, from flipping their lid. So we all know what trauma is, but what is trauma-informed care? The University of Buffalo defines trauma-informed care as being understanding and considerate of the pervasive nature of trauma and promotes environments of healing and recovery rather than practices and services that may inadvertently re-traumatize. When we train our teammates on trauma-informed care and what it is, we always review the definition. We talk about examples, but then we also, in some ways, we talk about I don't want to call it the simpler parts of trauma-informed care, but I guess that's what we'll call it. You know, it's how do we want to be treated? We want to empathize. If we'd been through what this individual had been through and experienced, and then we're at a place like a residential center, no matter where, how would we want to be treated? We might say we might not want to be held accountable, you know, if we're being goofy or something. But on one hand, we all benefit no matter what our role is, where we live at, from some sort of structure. You know, so how do we empathize? How would we want to be cared for? How would we want to be respected, talked to, and so forth? And that's a big part of trauma-informed care. Not the only part, but again, it is a big part of that, because we don't want to re-traumatize somebody. We want to help them feel safe, connected, and in control. And again, a lot of that starts with using empathy. So as we move forward with practicing trauma-informed care, we want to be sure as organizations that we are practicing SAMHSA's 5 key ingredients of trauma-informed care. The first of which is leading and communicating about the transformation process. Constant dialogue about what it is to be trauma-informed, why we're doing it, how becoming a trauma-informed agency is going to not only better the youth that we serve and the people we serve, but it's going to better our employees, no matter if they're a direct care provider, a therapist, a nurse, a teacher. It doesn't matter. The more understanding and knowledge we have of trauma, the easier it is to get everybody on board, and again, to best take care of those that we serve. We have to engage patients and clients in organizational planning. We want to learn what we think we know what their needs are, but what might they tell us their needs are? If we look at that voice choice control, what are your needs? What would you like to see? Training clinical as well as non-clinical staff members. Creating a safe environment, and again, that safe environment is not only for those we're serving, but the ones who are working to serve those that we're taking care for. We want our people to feel safe. The safer that we feel, the more effective we are in our jobs in taking care of youth and individuals. And that will also help us in preventing secondary traumatic stress in staff. Odds are all of us who do this work, we've experienced multiple traumas in our lives as well, and some of us might be carrying a lot right now. And then when you work in the field that we all work in, we experience a lot and we hear a lot from the youth, the kids, the individuals that we're serving. And that's a lot to take home. I'm sure all of us train our teammates on leaving home at the door and leaving work at the door when you go home. That's really easy to talk about. It's not really easy to do, you know, especially when we have people who are invested. It's hard for them to turn off. And that's where that burnout comes from. So what do we do to best support not only our kids or individuals, but the people who are taking care of our kids? So that brings us to the 6 principles of being a trauma-informed, the 6 principles of trauma-informed care and how we utilize those in being a trauma-informed agency. So the first is safety. So as an organization, we have to continuously and consistently ask ourselves, how do we ensure physical and emotional safety of those we serve, as well as our employees? So as we break down these slides as we move forward, not all of them, but quite a few of them are going to have some different sections. One about the youth we serve, and one about our staff as well. Because again, one thing we've learned with trauma responsive care is how do we help our employees feel these ways so they can best serve each other, but also best serve our individuals. We've got to ask those. We've got to remember that semantics are key. I'm sure all of us have either said or heard someone tell an individual or a kid who might be having a crisis episode or who just might be really upset that they're safe. Well, if we're telling someone they're safe, that's coming from a really good place. You know, our intentions are good, but that person might not think we're listening to them. You know, so instead of telling someone that we're safe, how can we help them feel safe? What do you need me to do to help you feel safe? How can I best help you? So we're not telling them how to feel, but we're asking them to tell us how to help them feel or how to feel safe. And we also want to remember the basics, you know, structured routines, consistency among shifts, among programming areas, among our team, amongst our teammates, being as predictable as possible for individuals while also being adaptable in case of a change in schedule, change of routine, and also being sure that we communicate what those changes might be with the kids or the individuals that we're taking care of. We want to stay solution focused and remember to provide ongoing training for all. Now, these are some basic things that we do for safety for our people and our kids, but then we're going to discuss a couple of things and share some examples of what we've done to also help our kids feel safe that we take care of, or our individuals. Along with that, we'll discuss some things that aren't listed here, and some of this could be very repetitive on a couple slides, just because a few of these descriptions that are listed, they can be used on multiple principles of care. So I've talked about our structured routines already. Earlier, I mentioned voice, choice, and control. But again, how do we give someone that voice, choice, and control? How do we make sure that they feel comfortable in that? Sometimes it's as simple as offering choices. It's as simple as checking in with an individual that we're caring for, but it's also finding that resolve once a tough episode or incident has happened. You'll see on the right with staff about how we provide support, ongoing training as well. Well, one of the things our leadership team is doing right now is working in ratio in the cottages with our staff to help support them, because we all know there's some tough spots with staffing across the state and across the country right now. Last Sunday, I was in a restraint that I led, first restraint I'd led in a long time. The young man was not happy by any means, and I don't think he should have been, because he was in a restraint. Luckily, we didn't have to stay in the restraint long, but as we were ending, I asked him if he'd like me to sit with him. Gave him the option, and he told me yes. We talked for a quick second, and I asked him if he'd like to take a break anywhere he'd like. You know, he wanted to go to his room. I got up, I offered him my hand to help him up, and I asked him if he wanted me to go with him or to stay away. He asked me to go with him. You know, we got to his room, and I asked him where he wanted me to sit. So I knew that even though he wanted me to go with him, that he wasn't too upset with me, because he still wanted that assistance or that feeling of a caregiver near him, but that didn't mean he wanted me right beside of him either. So I wanted to make sure he knew that he had say so in what happened next. He asked me to sit across the room from him. That's what I did, you know, and we sat in silence for a bit. We got to talking. He led the conversation, and then I might ask questions, and but he had that choice. He had that control. It wasn't, hey, I'm going to sit with you. It's what can I do to best help you feel safe, feel in control. We've got another young man, and then I'll move on to our next slide. Recently has lost a loved one in his family. And obviously, I mean, the stages of grief, especially as young as he is, we have teammates here at the center who are close with him, and he might be in the process of becoming dysregulated just from being upset and thinking about this loved one. And we have people who will ask him if they'd like to, if he would like for them to go on a break with him, you know, to give that support. And he might cry, they might give him a hug. They're there for him to offer that support. But then again, a couple of the other small things that we do, I shouldn't say small things, but there aren't real specific, is we recognize milestones. We provide opportunities for growth and recognition with our individuals, and we want to teach independence. Yeah, we always want to do things for those we take care of, but if we don't teach them how to do those things and do them together, they're not going to learn that independence to where that they can feel safer with or without the help of somebody else. And as far as safety for our employees go, another thing that we do is we do have a free and confidential employee assistance program. But we also encourage them to share with us, work with us, talk with us if they're feeling, just if they have an idea, if they're having a tough day, a tough time, and because we do want to support them, again, help them feel as safe as possible. Now, number 2 is trustworthiness. I'm sorry, it's trustworthiness and transparency. And we're back to the Hobbes principles a little bit again as well. So trust between child and adult is essential, the foundation on which all other principles rest, the glue that holds teaching and learning together, the beginning point for re-education. The majority of individuals, kids and youth that we all work with, they come from pretty traumatic backgrounds for the most part. They've a lot of them have been to hell and back. You know, they've had a tough time. They've been hurt by the people that we're taught to trust from the time we're born. You know? So when they get to us, why should they trust complete strangers? They shouldn't. You know, we can't blame them for not wanting to hear what we have to say, not wanting to listen, for bucking what the routine might be. You know, they got to think about themselves. Our brains are wired for survival and for safety. So how do we earn that trust? One, I'd like to think that we all appreciate that challenge they put in front of us to earn their trust, because again, we're wired for survival. So then we've got to be willing to do what it takes to earn that trust, because without trust, we don't hear one another. Without trust, we're not willing to give someone a chance. Without trust, we're not willing to try something new. So then how do we earn that trust from those we serve, and also from and with our employees? Oftentimes we get referrals, and we have a young man who might come to one of our agencies, and they might be a paper monster, you know, and we've got to remember what was the environment like that they came from. And we're not going to judge someone on what paperwork might say, what their past might say. Instead, we want to remember to respect it. Because unless we're in that situation that they're coming from or have came from, we can't necessarily say we know how we might act, how we might respond to certain things. So we definitely, again, don't want to judge our individuals based on their past, but we want to find their strengths. If we already know that individuals and kids wouldn't be in our care if they didn't need help. So let's find those strengths, because there's a chance no one else has tried to help them find their strengths. Again, we're back to consistency and structure. To move on a little bit from the list, I just want to share one more thing, and that is respecting privacy in a figurative sense and a literal sense. Don't force someone to share their story if they don't want to. They told that story a lot. Give them the opportunity to, or wait until they're comfortable to do that. If they need some space, respect their space. You know, it's okay. But a couple of other ways that we earn the trust of our individuals, our kids, we might do things. Well, we do celebrate things like birthdays. Again, big milestones. We learn sensory needs of the folks that we serve. It could be through them just telling us what they need, and then we hear what they say, and then we get what they need, again, to help them feel safe, connected, and in control. We the past few months we've hit on an initiative of writing positive incident reports. You know, and it's just, I call it a positive incident report because it's on an incident report form, but it's something that individual has done. That's good. It's celebratory, and we let them know that too. If we're looking for the strengths of someone, what they've done well, they see that, and again, that they know that we're going to earn their trust. I almost forgot as well. I'm sorry that I'm hopping back and forth a little bit. I apologize. But with respecting someone's privacy, one of the things that we've done in an agency, and again, this is a very specific example, is we have worked with a young man, and he had a sensory need and a comic skill that he liked to use, and that was brushing the hair of a doll. It helped him feel calm and feel safe. And one of the things that we do at the center, at the NECO Center, is we have minute sheets, and it takes about a minute to read. It's like an all about me sheet for each of our guys, and it's got their picture on it, and it's for our staff as well, especially if they're new. And it might share things like coping skills or things that help us feel better. But when I share this story with my teammates, or when I shared it with Kim, I shared that I know when I was 15 or 14 years old, if I brushed a doll's hair as a means to feel better, my best friend would have given me up the road and not let me live it down, and probably vice versa, because one of the things we do even as grown adults is we like to find ways to make us mad because we're big kids at heart. So a good chance that someone's peers today might do that as well. So we kept that information in a different location for our skill builders. That way they could still help this young man meet his need, but it wasn't there for his peers to see, because we wanted him to feel safe. We also wanted to earn it. We wanted to show him we're going to earn his trust by protecting his privacy. As far as trustworthiness for our employees go, we do our best to be consistent in communication. We own our mistakes. As an agency, we own them, and we also want to own our mistakes when working with, again, our kids and our individuals. We definitely want to seek input from those that are taking care of our guys. I'd like to think I know a lot about each one of our kids and young men that we serve residentially, but my teammates who are with them 40 hours a week, as opposed to my maybe 10 hours a week because of our different roles, they know a lot more about what's going on with each individual kid than I do. So I want to seek their input, whether it's in routine, in structure, what might be going on for the day, because they teach us a whole lot. We also want to provide support, ongoing training. We want to keep solution-focused mindsets, and sharing our wins and losses. Oops. Number 3 is peer support and mutual self-help. So Sampson describes peer support as encompassing a range of activities and interactions between people who share similar experiences of being diagnosed with mental health conditions, substance abuse disorders, or both. the needs of the individuals that we care for at the center, as well as their families. The peer support that we offer, it's approached a bit differently than it might be by other agencies and providers. And again, that a lot of that's due to the population that we do serve, but we do find ways to meet those needs of peer support. And one of the things that we do with that is, again, it's that focus on empathy. And this is one of those things that we're constantly in dialogue about with one another, and that is, again, how would we want to be treated if roles were reversed? If we were the kid or the individual and the people that we're taking care of are our caregivers, how would we want them to treat us? Or how we remind ourselves, how might we feel, how might we act, talk, if we'd been through what these young men had been through. And then if we had a kid, our own kid, who was in a residential center, how would we want them treated? You know, we want to focus on how would we want them to be treated. And then again, we have to focus on how we help others feel safe, connected, and in control. To help them, not only best want to help themselves, but be positive encouragers for their peers. So some other things that we do to meet this need of peer support and mutual self-help is honoring the experiences of those in our care. While we may not be able to directly relate to their experiences, we value their experiences. We learn from our kids, our individuals that we're caring for. They teach us, which rolls into the first HOPS principle, which is life is to be lived now. Life is to be lived now, not in the past and in the future only as a present challenge. We don't want anyone to forget their past, but we want to help them to feel what it's like to live in the present. We know that trauma lives in the body. It might be stored away somewhere deep in the back of our heads. The traumas that we've experienced, and the same for those we serve, but it lives in the body. And we have reactions to things that we might not be able to control, or control as well as we'd like to, because of things that we've experienced in the past. So how do we help someone? How do we help someone we're caring for to live more in the moment? And it's not done by telling them to get over it. You know, it's done by being with them. You know, finding opportunities to help them, understanding how what we do impacts someone else. The more solution focused we are, the happier and safer that someone feels. We also do our best to offer peer support to families. We work with a lot of parents, and parents oftentimes are the experts on their kids. Maybe a child or an individual that one of us is working with in our agencies, we feel kind of stuck. You know, well, hey, let's call mom or dad or whoever their caregiver was before coming away. Maybe there's something that we're missing. Maybe they can help us with this. When we make family, the caregivers, the prior caregivers, a part of the treatment team, you know, and we're recognizing their efforts, what they've done, what they know. It helps to motivate, and it helps to not only motivate them, but it helps them to trust us, to where, again, we can best help families and their kids. So as far as offering, I think I went too far, I'm sorry. Nope. Offering peer support to our staff. Again, we're going to hit on our EAP services, training and supporting our people, our employees in trauma responsive care. Again, we're trauma informed, and with trauma responsive care, it's definitely a component of trauma informed care. But how do we regulate ourselves, and how do we help someone else that we're caring for to regulate themselves? And if we're self-aware, if we know what our triggers are, what our fun buttons are, to where we can best respond in a safe, healthy, and positive manner to someone else who might be having a moment of worry, fear, of crisis. We emphasize our team and keeping all brains in the game. And what I mean by that is, again, we work with our teams who know our kids, our individuals the best, to where we can, again, best take care of our kids. Collaboration and mutuality. SAMHSA defines this as partnering and leveling the power among consumers and providers, allowing consumer control over treatment and recovery. We always want to ask ourselves, how are we collaborating with our individuals to best help them? How are we encouraging them? How are we finding out what they might want or might need that we might be missing? And we definitely want to ask them about this. I mean, we want to have those discussions. Again, that gives them that feeling of voice, choice, and control. And then we have to be sure that we are welcoming and respecting the sharing of feelings. We have to ask ourselves that. We might not appreciate when someone curses at us or says something about our families, and good chance those things are being said out of anger, and the individual or the kids we're working with might not really feel that way, but in the moment they're pretty hot, and that's at times that's pretty understandable. And with Hobbes, we remember that feelings should be nurtured, shared spontaneously, controlled when necessary, expressed when too long repressed, and explored with trusted others. When we're exploring feelings, we don't have to do that as a therapist by any means. Those of us who work with kids day in and day out, doing direct care, we know triggers of kids. We know our own triggers. We learn quickly what helps them feel better, and we never want to diminish how someone feels. Instead, we want to collaborate with them on how to help them feel safe, on how to help them feel heard, on how to help them feel as though they are a part of their treatment. They're not being treated, but they're a part of their treatment, to where we can best help them. Some things that we do with that is we have I wouldn't call it an initiative, but we call it best possible day. How do we give this person their best possible day possible? What does best possible day mean to someone that we're serving? And it could be something like they get to pick what their next outing is. We have a student store, and we want to get their input on things they can buy in the student store, or what kind of games and they might want to have in the cottages, what types of clothing that they might like, but and those to some people might seem kind of small, but when we're collaborating with someone on what they like, what they enjoy, how they feel, it's going to help give them a sense of ownership in that collaboration. Something else we do that might not sound as fun as outings or a student store is the life space interview, which is done. It's completed once a crisis situation is de-escalated, and everybody is regulated again. That life space interview, it's not about telling a kid or an individual that they've done wrong. And it's not only about them sharing what they could have done differently. Well, that might be a part of it. It's also, hey, what could I have done to help you in this situation? What do you need from me? Maybe it's an individual or a kid that we don't often work with, and we may have not done anything necessarily wrong, but we don't know them as well as we might another individual that we're working with. So let's include their opinions on what we could have done differently to provide that safe environment to help them stay regulated. Again, it's not saying we've done something wrong, but again, we're making them a part of that solution. We're collaborating together. As far as our employees go, it helps. As far as our employees go, with collaboration and collaborating with them and how they feel as employees of the NECO Center, one thing we have is a retention and a career path team. We all know that those in direct care and in this field overall, you know, our turnover it's tough, you know, and with our career path and retention team, that includes direct care providers. They're the driving force behind that, regardless of the program they're working in. And they'll share and drive that car about what we could do differently, what they believe our teammates need to have more say-so, whether it's in their jobs on their career path, in the care of our individuals that we serve. But we look for that feedback from them to where we can not only help those on that career path and retention team feel better and to know they're being heard, but it also allows those who might not be on that team to feel heard, because obviously they're working with the people who are on that team. Yeah, and again, we're constantly seeking feedback from our direct care staff. I want them to coach me. You know, if they're the child expert in this cottage and I'm helping them out, hey, what do you need me to do? You know, teach me, collaborate with me, help me help you. Find strengths in our staff members as well. We're not quite done yet, but with this collaboration and mutuality piece, some food for thought would be the brain can be damaged through experience, but it also heals through experience. And that comes from trauma responsive care from Aldrich Pele. If we know someone has been through multiple traumas or even one trauma, we know how it affects them, and we know how those instances negatively impact the brain. But by staying away and not engaging because we might be worried about making something worse, or we believe that they don't want us near them, well, they're not going to experience a positive relationship. I'm not saying we have to be right beside them all day, but we've got to be willing to engage and offer, being a part of their life. We have a young man, and he doesn't speak, and he's very sweet, but he's been through some tough stuff, you know, and he doesn't always want people around him. And that's understandable for he and a lot of the individuals that we work with in our agencies. One of the things that our people do with this young man is they'll approach him. They might ask him if he wants to throw his balls back and forth. They might ask him if he wants a fist bump, you know, and if he doesn't respond, cool, man, hey, I appreciate you, and we let him have his space, you know. But what we've learned is the more, again, that voice control, the more that we approach this young man and treat him in these ways, that we respect his wishes, his wants, but we don't give up either. He warms up to people, you know. He's learned that he's in a safe place and that people care about him. So we have to remember that the brain, yeah, it gets damaged through experience, but it also heals through experience. And then Bruce Perry said, people usually want to teach other people from the top down, but the brain actually works from the bottom up. And that brings us back to empathy. You know, we see that as getting on that person's level, you know, being with them in the moment, you know, not standing over somebody, but even physically sitting with them, you know, that eye contact. letting them teach us about how they feel, explain to us how they feel, why they feel the way that they do, and how we can best help them. We're not telling someone how to feel. We are listening to them tell us how to help them feel a certain way. All right, so some other things that we do with our guys we serve. We utilize we messages. It's not you do this, you don't do that. It's what can we do together to help you? What can we do to better our relationship? What can we do to help you feel safe? I mentioned finding resolve a couple times. We want to remember that it's okay for people to be mad. Even after we think something might be called off, it's okay to be mad. But we never want to just say somebody's mad, be done with it. We're not going to make them talk and necessarily work it out with us. But we want to find that resolve with them. We want to make sure that those we care for know that to us it was something that happened and that it's over with, that we still care about them. And that could be hey man, I love you. I know you're upset. If you want to talk, we can. If you don't, that's okay. But just know that I love you. And if you don't talk to me again today, I'll see you tomorrow. And then we do be sure to find them the next day and share that, hey, how are you? And oftentimes, even before the end of that first day, that resolve can be found. We want to seek therapeutic opportunities. And when I say therapeutic opportunities, I don't mean find time for them to see a therapist. I mean thinking about, hey man, let's go outside and pass football. Let's color together and talk about the day. Those therapeutic opportunities are that's us spending time with those we're caring for. And oftentimes when that happens, we learn more about what someone wants, what they need, and a lot can be opened up. And remember that those that we care for can teach us and train us. All right, we've got empowerment, voice, and choice, which goes kind of hand in hand with that voice, choice, and control that we've talked about. But we want to learn the strengths of our individuals, their experiences, and then we want to build upon those to prioritize strength-based and person-centered services. We want to promote resiliency and provide a culture of care that assists in recovering from trauma. Remember, we always want to be able to ask ourselves and ask them, what can we do to help you? They've been through a whole lot, and we want to respect that. We want to honor that. And we also want to understand how power differentials can negatively impact treatment and cause re-traumatization. We want to empower those that we serve, those that we care for, but we want them to know they're empowered as well. We want them to know they have a voice, and we want them to know they have a choice. It's kind of fun, and it's not funny, but I mean it is. We're charged with keeping these safe therapeutic environments, and we want to, but we also have to remember that we want those we're caring for to have a part in that safe therapeutic environment. How do they feel about it? Just because we feel like it's therapeutic for this person here, it could be for this other person. So we want to include those individuals in these conversations. We want them, again, to know that they're empowered. We want them to know they have a voice, they have a choice. So how do we make that happen? One, we have to believe that all individuals have strengths and can be motivated. I mentioned environments earlier, and it's key to remember, especially with Hobbes, that this isn't a principle, but it's a premise of Nicholas Hobbes. Children are more healthy than ill, and their problems are as much in their environments as in themselves. When we pull someone from, I shouldn't say pull someone, when someone leaves an environment of danger, of negativity, of abuse, neglect, and they go somewhere else to where they have time and space to be taught skills, whether it's educational, vocational, daily living skills, how to better manage emotions and feelings and share with others, well, we oftentimes see a big change. We also, as caregivers, we want to choose our battles and remember to listen, and as opposed to speaking. And when I put this together, it reminded me of another young man that we used to serve who's transitioned to a less restrictive level of care. And he would sometimes get pretty upset, and he would go on these rants, and he'd be 100 miles an hour. And you would know oftentimes when he was speaking and he was just going and going and going, that some of what he was sharing, it was probably a half truth, because maybe we even saw or heard some of what was happening beforehand. Maybe he didn't realize that, but we knew it wasn't 100% accurate. But with this person, with this young man, if he would just stay quiet and listen and show him that he's being heard, at the end of that story or that information he's sharing, whether there's some things that aren't accurate in there or not, oftentimes he made the right choice at the end, and he made it a point to do something good, but he wanted to be heard. If it's so key to take the time to hear what's being said by those we're caring for. And then again, that helps them to feel safe, connected, and in control. Even if we know they aren't telling the full truth, or the truth at all. If we give them that time, they feel heard, and that's where relationships can definitely be built. That's another simple way to earn trust. And with our employees, our teammates, again, we want to identify their strength. Is there a certain age group this person works better with? So we'll go on to our last bit, and that's cultural, historical, and gender issues. The NECO Center actively looks for ways to best meet the cultural, historical, and needs related to gender, sexuality for our residents and employees. We're constantly providing ongoing training to our employees pertaining to cultural diversity, self-awareness, trauma-informed care, and secondary traumatic stress in staff. With this, we're identifying how different cultures handle and or deal with stress, trauma, and other triggers. And we really hit hard on understanding, empathizing, and accepting that those we serve are not like us. That can be their religion, their race, their sexuality. So some things we do with it is we include those we care about and we care for on teaching us about who they are, where they came from, how we can best help them. And we take into consideration how traumatic it can be coming to us from somewhere else, from 6 hours away in Ohio, and they've never been to Lawrence County, Ohio. We celebrate individuality with our youth, our individuals, and our staff. And we recognize how we as caregivers are different from one another, as well as those we care for. We're not all the same, and we're mindful of that, where again, we can best take care of our people and those youth, those individuals that we're caring for. The kids we work with, the individuals that we work with, they come to us with a lot of different traumatic experiences. They've survived physical, emotional, sexual abuse, mental, emotional, and physical neglect. So we have to be aware of how to best engage with those that we're caring for. And we've got to respect and appreciate that we're charged to care for kids that we might not know everything about yet. And it's always key to remember that if we're wearing our trauma gloves, we're not going to re-traumatize, or it's going to be super hard to re-traumatize. But when we choose to not wear our trauma gloves, it's much easier to cause re-traumatization. As we look more at the historical issues and needs of our individuals, as caregivers, we want to seek to learn as much about those we're charged to care for. But again, we always get 100% of that information. So we train and practice with our teams on utilizing scripted responses. We validate, respect, and honor what our residents, those we care for, have been through and survived. We want to celebrate their resiliency, their past. We work with our teams on identifying their triggers without invading privacy, so that we can provide the safest and most respectful responses when triggers are met with trauma reminders. We, as we tie everything together, we want to remember that we can help someone feel safe, connected, and in control if we don't behave in those ways, and if someone does not feel safe, connected, and in control, they have a difficult time processing the safety of their surroundings. They might struggle to receive information that's being said and given to them. So if we're going to help someone feel safe, connected, and in control, we have to remember these HOPS principles. And again, one is living in the now. They've got to be able to trust their caregivers. We've got to earn that trust. We have to be sure we're nurturing their feelings. And earlier in the presentation, I mentioned ceremony and ritual. That's oftentimes linked to birthdays, celebrations, but it's even small things throughout the day or the week that our guys can look forward to. And again, we want those we care for to be able to find some sort of joy in each day. And sometimes we've got to find that to give to them. Even if they're having a really rough day, we got to find at least something to give them that helps them be happy, helps them know they're cared for and they're loved. So I want to end with a quote that I've taken from Safe Crisis Management, and it's kind of lengthy, so I apologize. And that is it's from a teacher. I have come to a frightening conclusion. I am the decisive element in the classroom. It is my personal approach that created the climate. It is my daily mood that makes the weather. As a teacher, I possess tremendous power to make a child's life miserable or joyous. I can be a tool of torture or an instrument of inspiration. I can humiliate or humor, hurt or heal. In all situations, it is my response that decides whether a crisis will be escalated or de-escalated and a child humanized or demonized. We're all charged with a pretty hefty responsibility. And we've got to be sure that we're always doing our best to be in control of our own emotions, that we're feeling safe, connected, and in control, again, so we can help those we serve to feel safe, connected, and in control, to where they know they are in an environment of care, a loving environment. Everyone, I appreciate your time today. Thank you for bearing with me through my presentation.
First of all, Tyler, thank you so much. When we started talking about ways that both ODJFS and Ohio Mental Health and Addiction Services can partner together in helping our agencies sustain QRTP compliance, we really knew that we had to hear from you. We had to hear from those that are living and breathing this this heavy lift every single day. And so with that, we really wanted to reach out and have you become our partners in this presentation. And Tyler, you absolutely killed it for the first one, and we're so honored. And thank you for telling those stories that are so personal to you and your team. I had to chuckle when you put the quote up because it's one of my favorite quotes. As soon as I saw it, I thought, oh gosh, you know, it affects all of us. So thank you, Tyler. Thank you to everyone on behalf of ODJFS and Ohio MOS. We are so grateful for you to attend today, to be a part of our survey that we asked for your requests and your needs. Thank you to Kim for helping stand up the launch. With that, thanks again to Tyler, to Kim, to Brandon. He is our tech man behind all this that you can't see, but we thank him for his efforts. And with that, be well. Take care of each other, take care of yourself, do your thing. Thanks. Have a great afternoon, everybody. Bye-bye.